This video is one in an intended series of short videos called Intro to Unusual Medical Procedures and Medications That Can Harm. Disclaimer: this video is not intended to provide medical advice, diagnosis, or treatment. This video details and illustrates an injury I experienced due to ultrasound therapy, also known as physiotherapeutic ultrasound or therapeutic ultrasound diathermy. It also explains some basic concepts of ultrasound therapy and its associated equipment and important cautions before administering or receiving ultrasound therapy. Injuries due to ultrasound therapy are not unique to me. In searching the medical literature and patient reporting forums online, I found a number of instances of reports of injuries from ultrasound therapy with some similar prolonged symptoms from the injury. I also found a peer-reviewed study that says, quote, "There is little evidence that active ultrasound is more effective than placebo in treatment for treating patients with pain or a range of musculoskeletal injuries or for promoting soft tissue healing." End of quote. It's from a review of therapeutic ultrasound effectiveness studies by Robertson Baker. It was on the NIH site. First, a quick overview of ultrasound therapy technology and cautions associated with its use, with illustrations included. Ultrasound equipment is designed to heat tissue in the body, typically at a depth of 2 to 5 centimeters, which is approximately 0.8 to 2 inches below the surface of the skin, using a sound wave frequency of 0.7 to 3.3 megahertz, that's 3.3 million cycles per second. This technology does not produce an image. Ultrasound therapy and its associated equipment should not be confused with diagnostic ultrasound, also called sonography. Diagnostic ultrasound produces images. It typically uses frequencies of 1 to 6 megahertz to image deeper tissues. It uses 7 to 18 megahertz to image structures near the surface of the body. Typically, diagnostic ultrasound produces little heating of body tissue. Ultrasound therapy equipment ranges in cost from $150 to $2,250. Diagnostic ultrasound equipment ranges in cost from $20,000 to $115,000. The photo on the left is therapeutic ultrasound equipment. The photo on the right is diagnostic ultrasound equipment. Ultrasound therapy is applied using a piezoelectric transducer within the head of the wand probe that is in direct contact with the patient's skin. Gel is used on all surfaces of the head to reduce friction and assist in transmission of the ultrasonic waves. The ultrasound can be pulsed or a continuously transmitted wave. Therapeutic ultrasound in physical therapy is alternating compression and rarefaction of sound waves with a frequency of 0.7 to 3.3 megahertz, 3.3 million cycles. This is a picture of ultrasound being applied. The head can be smaller or larger depending on the equipment. Due to the heat generated in penetration to the body tissue below the surface of the skin, there are explicit cautions in the medical literature and equipment manuals to keep the head of the ultrasound device always moving, since leaving the head in one place for even a short time may cause overheating and pain in the client, and in some cases permanent damage to the tissue and nerves below the surface of the skin. A typical warning in ultrasound therapy manuals is as follows. Quote, danger, keeping the ultrasound head stationary during use may burn the covering of bones and damage internal organs, unquote. Also, the following warnings are in some manuals. Ultrasound therapy should not be used on these body parts: over the abdomen, pelvic regions, or lower back in women who are menstruating or pregnant, over lesions, broken skin, or healing fractures, around the eyes, breasts, or sexual organs, over any areas with plastic implants, over or near areas with malignant tumors, over areas with impaired sensation or blood flow. Ultrasound should not be applied to the brain, spinal cord, or large subcutaneous peripheral nerves. Should not be used with clients with implanted devices in proximity to those devices or their connections. I've had 2 ultrasound treatments in my life, one in the late 70s by an MD on my foot with no injury I noticed from the treatment, and one by a chiropractic acupuncture center in San Diego region of California in 2006, which caused an injury and still causes pain as of this video production in 2020. The 2006 treatment was done by the practitioner by training her assistant to administer the ultrasound treatment on my right occipital region at the base of my skull. This was done without telling me what was going to take place before doing it. A close approximation. This picture approximately shows where my injury was. My injury, in fact, is slightly more towards the ear and slightly more under the hair region, the mastoid kind of region. The picture next to it is the skull anatomy showing the occipital regions. The injury, I did research on why the practitioner was using ultrasound in that the base of my skull. My investigation uncovered that she was likely trying to heat the trigger points at the base of the skull that can be associated with chronic pain in the shoulder and trapezius region. My pain from the shoulder area injury was why I had gone to this practitioner. The ultrasound practitioner violated at least 2 warnings associated with using ultrasound equipment. The first is, do not use ultrasound therapy near organs such as the brain. The second is to be sure and keep the wand head moving or dangerous heating may occur. 14 years after the injury, I still have pain and a strange sensation and light swelling in the area of my skull. A neurologist and other MDs have examined me and speculate that some nerve and muscle fibers may have been burned by the treatment. Even though my treatment was administered in a prohibited area, in researching ultrasound therapy induced injuries, I came across reported injuries in parts of the body where there was no prohibition about administering ultrasound therapy, but injuries similar to mine occurred. This concludes my information about my ultrasound injury and research I've done about other injuries and effects. Remember, this type of ultrasound injury, therapeutic ultrasound, can penetrate the skin, below the skin, up to 2 inches, which is about 5 centimeters, and can cause a hidden injury that may be hard for your body to recover from. Thank you.